Arthritis is a group of over 100 conditions affecting the joints and surrounding tissue. Symptoms vary but often include pain, stiffness, swelling, redness, and decreased range of motion. Osteoarthritis, the most common type of arthritis, mainly occurs in the hands, spine, hips, and knees. Bones in affected joints become weaker, the connective tissue that holds the joint together deteriorates, and inflammation damages the joint lining. Rheumatoid arthritis is the most common form of autoimmune inflammatory arthritis. With RA, the immune system is overactive, attacking healthy tissue including joints in the spine, hands, and feet. In some people, inflammation becomes systemic, damaging the eyes, skin, heart, and other organs. Risk factors for arthritis include family history, age, biological sex, previous joint injuries, and obesity. If you're experiencing any symptoms, talk to your primary care physician. Learning about the disease and treatment options, making time for physical activity, and maintaining a healthy weight are essential.